Welcome, I'm Divya. Today we talk about one chronic issue that is affecting a significant chunk of our population, and that is diabetes. Now, we have an estimated 77 million people above the age of 18 years suffering from type 2 diabetes, and nearly 25 million are pre diabetic, according to the WHO. Now, more than 50% of the people are unaware of their diabetic status, which leads to health complications if not detected and treated early. Now, adults with diabetes have a 2 to 3 fold increased risk of heart attacks also and of strokes. Now, this discussion today, featuring top endocrinologists from India, aims to raise awareness about the grave consequences of neglecting diabetes and the critical need for early diagnosis, lifestyle changes, and consistent treatment to prevent these life threatening complications. I have a very eminent panel of doctors today to discuss the topic complications of neglect, the long term effects of untreated diabetes in India. So, we have joining us today, we have Dr. KVS Harikumar, consultant endocrinologist, Magna Centers and Fernandez Hospitals, Hyderabad. Welcome, sir.
Hi.
We have Lieutenant General Dr. Narendra Kotwal, AVSM, SMVSM, retired Director Endocrinology, Paras Health, Panchkula. Welcome, sir.
Thank you.
And we have Dr. P.K. Jabbar, Professor and Head of Department of Endocrinology, Director and CEO of the Indian Institute of Diabetes, Trivandrum. Welcome, sir.
Thank you.
So without wasting any time, I'm going to jump straight into the questions. Dr. Kumar, coming to you first. Now, what do you think are the most common long-term complications of untreated diabetes?
Yeah, untreated diabetes actually leads to most of the problems, and the commonest cause of heart disease, the commonest cause of stroke, the commonest cause of amputation, the commonest cause of vision loss. Plenty of complications are there if you have untreated diabetes, because in a long term it affects the blood vessels of the entire body, be it a bigger organ or a smaller organ, and that will cause problems. And to top of it, you have some of the food problems, amputations, one of the commonest cause long-term complications of untreated diabetes. So you have a whole host of complications if you have poorly controlled diabetes for a long time.
Absolutely. So it's very important. I think it's become very casual to say ki, yeah, somebody is getting diabetes or you have been diagnosed, but it's extremely important to recognize the kind of ramifications that it can have. So, Dr. Kotwal, what is the prevalence of diabetes and related complications in India?
Yeah, thank you for that question. Recently, a study was conducted by Indian Council of Medical Research along with the India Diabetes Study Group. And this study was over a period of 8 years, and results were published last year. The overall weighted prevalence of diabetes in India is 11.4%, and pre-diabetes is 15.3%. So we are looking at a staggering figures. Along with it, hypertension is to the tune of 35.5%. Obesity, generalized obesity is 28.6%. But area of concern is about the abdominal obesity, which is to the tune of 39.5%. And dyslipidemia, which is again a risk factor for cardiovascular disease, is 81.2%. So overall, we have a huge figures of metabolic disorders in India.
Right. So that is definitely concerning. Dr. Jabbar, now, if we continue talking about specifically India, what are the primary reasons for uncontrolled or untreated diabetes?
Very nice question. In fact, Dr. Kotwalji is discussing the epidemiology of metabolic problems. In addition to that, there are a huge number of patients remain undiagnosed. So in Kerala state, it's around 19%, and there are a lot of contributing factors for this type of problems happening in our India. Of course, still awareness factor is minimal. There is no doubt about that. People are taking a lot of effort, but awareness is less. And second thing, especially in certain part of our India, the healthcare system little inadequate. There is no doubt about that. Whatever said and done, financial constraints very important contributing factor for that. And yet another important issue, especially patients factor, is non-compliance. Whatever you say, patients are not following. And probably they take different advice from different places. And eventually, they will have a lot of problems. developing diabetes, developing issues, and lot of myth also. In certain part of India, there are a lot of interesting myth is also happening. So,
Okay.
and see, literacy status, you can discuss in health literacy or illiteracy. It's not
Yeah.
that uncommon. So these are the various, at least few factors responsible for jumping prevalence of diabetes and its issue in our India. There is no doubt. Thank you.
Right. So, sir, non-compliance, of course, is huge, but I would quickly, you mentioned that there are some myths also which are really prevalent. I would love to know if there are a couple of quick myths that you could, just bust right now.
So very interestingly, there are people that treating with certain medication which doesn't have any scientific value. Okay.
Okay.
And they think that, see, diabetes is a curse of our God, right? Okay.
Okay.
There is no medicine for that. Once you get diabetes mellitus, that indicates your life is over. Okay. And they think that insulin treatment, they feel that if you take insulin, no, this is haram. I don't want to take. And eventually they will not take it. They feel that say insulin, number one reason is not good. Number two, it's derived from some source which is also and not acceptable for our culture. Very interestingly, if you are starting insulin, people think that okay, my days are over. So many, I think if you want to discuss myth in diabetes,
Okay.
at least this will take minimum
That's
1 hour.
another huge
Okay.
area
Correct. Yeah.
that one can get into.
Go
Okay, now,
ahead.
Dr. Kumar, how does untreated diabetes lead to cardiovascular complications?
Yeah, see, if you have uncontrolled glucose, basically it is higher amount of glucose in the blood. The
Right.
more glucose partly will get converted into acid, partly will get converted into some toxic elements which are not able to be digested by the body. So what happens, there is increase in the cholesterol also which goes along with it. So
Mhm.
all these things put together, there is always a narrowing of the blood vessels. So
Okay.
narrowing of blood vessel is an important path for all nutrients to come into the organs and take back all the unwanted waste back to for the cleaning. So if your blood vessel is narrowed, you are
Hmm.
likely to have strokes at every organ, be it your brain stroke, be it your heart stroke. So uncontrolled diabetes along with cholesterol deposits in the blood vessels, both will lead to increased risk of all cardiovascular ailments. And that cardiovascular may be what we look at strokes or even the foot disease. Common as if there is a ulcer, it is not getting healed because the blood is not coming to supply nutrients that clean up that area. So
Yeah.
if you don't have a good blood supply, you're likely to have problems, and hyperglycemia, that is a glucose in excess, is going to cause all these problems.
Okay, interesting. Now, let us start talking specifically of body parts. Dr. Kotwal, why is diabetic nephropathy, which is kidney damage, one of the most serious complications of untreated diabetes?
Yeah, that's right. No, see, diabetes, as Dr. Hari told you earlier, it affects the blood vessels. So
Yeah.
diabetes should be seen as a disease of a endothelium. Endothelium is the layer, internal layer of the blood vessels. So
Okay.
untreated blood sugar, it keeps on damaging the endothelium. In the kidneys, there are small blood vessels in the glomeruli which get damaged by the untreated hyperglycemia. And once damaged, there is a leaking of the proteins from the kidneys. Once this leakage starts, there is a relentless decline in the kidney function, leading to chronic kidney disease and stage renal disease, which requires a support in form of a dialysis or renal replacement or kidney transplant therapy. Point to remember is once diabetic nephropathy sets in, it becomes a risk factor for other diseases like cardiovascular disease, as Dr. Hari told you. It becomes a
Yeah.
risk factor for bipolar infarction and stroke. So it is pertinent to control blood sugar at the inception, try to prevent the diabetic nephropathy by taking care of the other risk factors and use
Yeah.
nephroprotective medications.
Okay, Dr. Jabbar, now let's shift our focus to the foot, which of course is again a very important part. Now, what are the diabetic foot infections and how can they be prevented in patients who have diabetes?
In continuation with the discussion of my colleagues, Dr. Hari and Dr. Kotwal,
Yeah.
diabetes complications start from up. The brain attack, heart attack, kidney attack, foot attack.
Okay.
And very
So
important,
that's the way it flows usually. That
not that, okay, simultaneously affects. But these
okay.
are the most important complications. And I forgot to mention some vision attack also, right? Okay.
Right.
So diabetes put, if you take the causes of, say amputation, that means a removal of your foot. The commonest cause of removal or amputation is diabetes. You take the data from our official website. The commonest cause is diabetic foot. Why it's happening? Because two issues are there. Blood supply is affected. Okay,
Yeah.
blood flows very continuously, very smoothly because of diabetes problem, associated cholesterol problem, associated many other problems. Blood flow comes down. That is number one reason. Number two, as my colleagues were discussing, this glucose and other waste material that can deposit on the blood vessel. So because of these two important factors, what will happen? The blood supply will come down, right? Okay. One
Yeah.
fine day morning, you will develop some sort of, you can wound or ulcer, you can call it as ulcer, right? Okay.
Right.
And this ulcer, if you are detecting much early, you can prevent one removal of your foot, right? Okay. But if you are not detecting, if you are not taking care of your diabetes status, cholesterol status, this will become serious. And one fine day morning, you will come to casualty with diabetics foot, very severe degree of diabetic foot right now.
Yeah.
And how to detect, how to prevent, that is important for us. Very simple. You need not go to your medical college or your primary care physician. Just inspect. You see what's happening in your foot. So you are spending at least 2 minutes for preparing your face, like
Yeah.
that. You just see what's happening with your foot, especially
Right.
you see what's happening in between the, we can call it as toe, right? Or finger, toe, whatever, right?
Yeah.
What's happening in that area and what is happening in the last part of your foot or sole of the foot, okay? And if you are detecting something, and what will happen, you may be having one small stone or some less of breaking, something like that, and that will produce, and you are not sensing it. You are
Yeah.
not sensing the pain. So what will
Right.
be the result? You will develop small wound and subsequently infection comes up and you will develop severe disease. And not only that, with one amputation, very important factor, you have lot of complication other organs also, including your heart. So if you are developing a severe disease or removal of your foot, you are a risk candidate for dying because of multiple heart attack, or you can call it as brain attack, all those things. So it's very important to detect, very important to treat from physician side, patient side, and other health workers side also. Definitely, you can prevent this complication. There is no doubt about that. I want to emphasize
Yes.
early detection of foot problems, very, very or paramount importance in our management of diabetes mellitus.
Absolutely. So, sir, as per what you said, since the senses are really low, or probably people are not able to feel anything down there in their feet, it is very important just to treat it with as much care as you probably do your face, and just spend some time every night before you go off to sleep or early morning, and see that there are no little cuts and nothing that can, in the future get aggravated, and just kind of nip it in the bud whenever it happens. Right. And Dr. Kumar, now if we come to neuropathy, now what role does neuropathy play in untreated diabetes, and how do you think that can impact the daily life?
Yeah, in continuation with what Professor Jabba said, the
Yeah.
pain is one sensation which actually highlights or leads you to the problem. But unfortunately for diabetics, you
Yes.
don't get that protective sensation. Pain is actually, it is painful, but it actually tells you to look at that particular part that yes, there is some problem there, you need to address it. But if
Right.
somebody has got no pain, he's not going to look at it, and he will keep on incubating or let it progress so much that it becomes very difficult to handle at a later stage. So
Yeah.
diabetics, the biggest problem is some of these loss of sensations. So you actually don't feel anything whenever there is a problem. I mean, say a small thorn gets in, a nail gets in, or you have injured, you have hit your foot somewhere. There is a
Right.
small nail comes out, and you have not painful. It is not affecting you. You are just carrying your day-to-day activities, and maybe you realize it after a month or 2 months when it is too late, but the infection has spread across. So
Right.
the biggest problem is loss of the pain and loss of the sensation. Second important thing, neuropathy, how it affects the patients is actually there. It cripples their day-to-day life, because if you have loss of the position sense, you're
Hmm.
unable to stand properly. You're unable to walk properly without balance. So that itself will lead to more falls. That itself will lead to more complications. So some of these things are actually more or less on day-to-day terms will affect the patients. Other point is actually most of the times patients do have some burning sensation, or the sense which is in both the hands, feet, everything in the night, they're unable to sleep. Persisting complaints of neuropathy.
Okay.
Unfortunately, the treatment options are limited. So best is to have a good control right from day one to prevent the neuropathy. That is the best way to handle this rather than treat it at a later stage.
Absolutely. Now, Dr. Kotpal, as all of you have already mentioned about the eyes, let us talk about that a little bit more. If you could tell us, how can untreated diabetes have an impact on our eyesight?
Say, one of the major complications of the untreated diabetes is the involvement of the eyes in retina, which is called a retinopathy. So, as the hyperglycemia keeps on damaging the blood vessels, which I alluded earlier also, once there's a
Mhm.
damage to blood vessels, there's a leakage of the proteins and various materials into the retina, which are known as the exudates. And these exudates keep on damaging retina, leading to diminished vision and blindness. One very important point to remember is for all diabetic patients, say at the time of diagnosis, also there may be subtle damage to the retina. So it is
Okay.
important to have a detailed fundus examination right at the time of the diagnosis of type 2 diabetes, and subsequently also periodic examination of the fundus should be done. Not only that, besides retinopathy, diabetics are more prone to glaucoma and cataract also. So it is important to have a good glycemic control and control of other risk factors also like hypertension and dyslipidemia.
Now, Dr. Jabbar, if you could throw some light on what is crucial in preventing complications in diabetes.
Say number one, early diagnosis. See our Endocrine Society of India,
Yeah.
very active for this type of awareness program. In fact,
Hmm.
we had a beautiful session on pre-diabetes, which means before developing diabetes. Right?
Yeah.
Okay, we are giving lot of emphasis for that, and you pick up diabetes much early. That's the reason people are conducting lot of screening programs. You go to
Hmm.
any place, especially now, but 14th and so people are doing lot of camps for detection. That is number one.
Okay.
After detecting, very important, what sir was discussing, even at the time of diagnosis, you may be having problems in your kidney, eyes, and other areas of your body. So it's very important. I want to emphasize that even at diagnosis, at outset, beginning of your life with the diabetes mellitus, you check your eyes, you check your kidney, and you check your body properly with the help of a physician or any health worker for that matter. If you are not detecting kidney
Yeah.
problems much early, once the creatinine goes up, so advanced stage, you have only one method, that is kidney transplant or something like that. So early detection and vision problems, my dear friends, see, the most important commonest cause of vision loss in young age group, probably less than 50 years, that is diabetes mellitus. That too is a preventable disease. Just go to your ophthalmologist or physician. He will give an idea that, okay, your eyes are affected. So take extra care to reduce the complication in related to vision. We have seen a lot of cases, even doctors, even paramedics also thinking that, say, my vision is okay. Why should I go to ophthalmologist? Why should I go to physician? No, please take an important message from me. Vision
Hmm.
may be normal. Most of the situations, vision is normal. very important to look for your eye examination, not your vision. Like, so, dekhne ka mushkil hai kya? No, it's not that. You just see the inner part of your eyes. You can call it as retina. By using certain medication with simple instruments, you can detect what is happening in the inner part of the retina. Mind you, it's a very preventable situation. Kidney also, just go to your laboratory, give your urine. They will do one simple test. They will give you the information that, okay, your kidney is involved, right? And good examination by your physician. That's very important. Yet another interesting issue. Now, lot of good molecules are there. Lot of methods are there to whatever complication happened today, probably 20% something like that. You can arrest there. You can arrest the complication progression by using lot of medications are available now. In the medical situations, medical fraternity, you have good molecules for preventing the issue. Overall, what I want to tell you that early diagnosis is important. Once you diagnose, monitoring, frequent monitoring, how frequent is a difficult question, but all these things are important for a very positive health.
Absolutely. So early diagnosis is definitely most important. But Dr. Kumar, if you could tell us, can lifestyle changes, which of course is also, can be given a lot of blame, can lifestyle changes help us in reducing the risk of complications from untreated diabetes?
Yeah, that is, I would say, the fulcrum or the foundation of management is lifestyle. Actually, it is a lifestyle disorder, and if you see the burden of diabetes in the last decade or maybe 2 decades, it is only the change in the lifestyle which has led to this explosion. So lifestyle encompasses what you are eating, what time are you eating, what time are you sleeping, what is your daily routine of exercise, how much of stress you are able to handle, are you a shift worker, because everything will affect the body. So unless you put the lifestyle change on a day-to-day basis, you are not going to get away from the complications of diabetes. Most of the times patients do ask, say when we start tablets or when we start insulin, sir, can we have sweets now? I mean, that now that you have started a tablet, but it is not going to help you that way, because the foundation or the fulcrum is only the lifestyle. Anything on top only comes your tablets, anything on top only comes insulin. It cannot be that you forget lifestyle. No matter how many drugs you take, you're not going to get away from the complications. So every time, I only request that every time emphasize about what you are eating. Are you smoking? Have you stopped smoking? Have you reduced your alcohol? Are you doing a regular exercise? So all these things have to be emphasized, re-emphasized at every point of time. Unfortunately, the sticking to a good lifestyle measures is difficult, but the more amount of such knowledge, and that will help the patient in understanding that they have to stick with it to prevent complications.
Absolutely. And I think if we start taking it like from our smallest unit, which is a family unit, and as a family, if everybody starts taking care of their health, so be it whatever age group, I think automatically the lifestyle on the whole will improve. So, Dr. Kotwal, a very important thing, especially being an Indian, all of us are very interested in household remedies. And of course, we are also going to traditional practices as well. So, as per you, do you think there are any household remedies that we can advise to our viewers, or any traditional practices that can complement diabetes treatment in India?
Thank you, Divya, for asking me this question, pertinent question. Yes, in India, various household remedies and traditional practices are commonly used to complement conventional diabetes treatment. We see people using fenugreek seeds, bitter gourd, Indian gooseberry, cinnamon, neem leaves, aloe vera. So many of these products are used. But important point to remember is all these products cannot replace the pharmacotherapy. These things may decrease the blood sugar to a certain extent. All these remedies should be used in conjunction with the pharmacotherapy and lifestyle management. And it is important and advisable to consult your healthcare provider, as some of these medications may be interfering with the pharmacotherapy which one is taking, or it may not be suitable to everyone. So it is important to consult your healthcare provider before using such remedies.
Right. So I think one good thing to remember is, do not think, first of all, if you're taking medication, it is okay, I can have extra jalebis or extra ice creams. Lifestyle on the whole is very important. You have to exercise, you have to take care of your mental health, physical health, all of it, the diet that you're consuming in totality. And of course, remember, the doctor is the one and only person who can give you the best guidance. So that is most important. Now, before we wrap up, I would love all of you probably to share one mantra which, can help our viewers with regards to our topic today.
Walk more and smile maximally, live in the present moment. So it will take care of your diet, exercise, and stress part. And today morning, in fact, I just made 2-3 lines. If you permit, I will say, eat
Absolutely,
with,
we would love to
yeah,
hear.
eat with
Yeah.
wisdom, choose with grace, let the wholesome foods find their place. Fruits and greens, grains of whole, feed your body, nourish your soul. Move each day, don't stay still. A simple walk can guard your will. Stretch, dance, or jog a while. Let exercise bring you a smile.
Fantastic. That's lovely. Great. Dr. Kumar?
Diabetes is traditionally known as silent killer. So
Yes, sir.
you need to be aware of it, be aware of its side effects and the complication. If you take care of your control, if you take care of your medicines, if you do a regular follow-up, that is not going to trouble you. As long as you take care of diabetes, it is not going to trouble you. If you neglect it, it is going to cause a lot of havoc in your life. So just take care of it. That is most important to prevent short-term and long-term complications.
Absolutely. Thank you, Dr. Kumar. And Dr. Jabbar, your one mantra that you would love to share with our viewers?
Diabetes is not an enemy. Okay. And the slogan is very simple, well-being. Okay. For that, just manage, just treat diabetes as a smooth disease. It's only lifestyle disease. You have lot of role to play, which you should do. Okay. And
Right.
your physician is your friend. Okay. Take his advice and manage diabetes smoothly for a positive health. That's all. Thank you.
So, with this, we would wrap the discussion in the interest of time. Now, this has been an extremely enriching and informative discussion that will help people deal better with diabetes, often also referred to like how Dr. Kumar shared with us as a silent killer. Now, diabetes can be managed and controlled as shared by our renowned panelists today. I'd like to once again thank all of you. Thank you, Dr. Kotwal. Thank you, Dr. Kumar. And thank you, Dr. Jabbar, for joining us and being with us today and sharing this very crucial knowledge in public interest. Thank you so much.